It is important to avoid getting pregnant with high-order multiples in order to avoid the complications that are associated with multiple gestation pregnancies. Many couples who struggle with infertility would welcome any pregnancy, including twins. However, not all couples realize the complications that can arise from a multiple gestation pregnancy or even a high-order multiple gestation pregnancy, which is triplets or greater. The two most common problems that can arise from a multifetal pregnancy are, number one, preterm labor, and number two, preterm delivery. Babies who are born prematurely have an increased risk for developing problems with breathing, problems with their bowels, and even problems with their eyes. And I encourage the patient to discuss this with their doctor. Additionally, there are other complications that can arise that can affect the fetuses from a multifetal pregnancy. And they are, number one, the inability to grow very much inside of the uterus. Number two, breaking the bag of water too early. And number three, there's an increased risk for fetal death, even after birth. Lastly, there are complications that can arise to the mother from a multifetal pregnancy. And those can include an increased risk for nausea, vomiting, gestational diabetes, preeclampsia, which is high blood pressure, and an increased risk for a cesarean delivery. Responsible embryo transferring is the limiting of the number of embryos transferred back into the uterus at the time of the uterine transfer. And this is important because this decreases the chance of developing a high-order multiple gestation, and thus it decreases the chance of developing complications that can arise from a multifetal pregnancy. The goal of responsible embryo transferring is to maintain a high live birth rate, but diminishing the chance of developing a high-order multiple pregnancy. Elective single embryo transfer is commonly offered to patients who are good candidates with high-quality embryos. The American Society for Reproductive Medicine, also known as ASRM, and the Society of Assisted Reproductive Technologies, also known as SART, are two leading infertility societies in the United States. ASRM and SART jointly publish guidelines discussing the appropriate number of embryos to be transferred into the uterus at the time of embryo transfer. These guidelines are based on strict criteria, including the age of the woman and the number of embryos that are available for transfer. In 2009, these guidelines were revised to clarify that although exceptions are allowable for women of less than favorable prognosis, these exceptions are quite limited. Regardless of prognosis, only one more embryo than called for by the guidelines should be transferred. Ultimately, deciding on the number of embryos to transfer should be a team decision. The couple, the physician, and the embryologist should discuss the guidelines and discuss the appropriate number of embryos that should be transferred. I encourage every patient to ask their doctor if the number of embryos that are recommended is the responsible number of embryos for them.